Hi, Gary here. Recently I was reading an article from Vanguard on a survey they did of 9,000 successful investors in their early 60s, and they came up with the 7 major personal concerns that they have, and 5 of them are about health. And what we're finding is 100 is the new 60, that with the health and the capabilities that we have currently, we'll be able to really live very good lives all the way out to age 100. But obviously we have to make sure we maintain a good health during a time frame. So I'd like to cover 5 key digital changes coming about in the next 5 years for your consideration. The first is smart wearables. Apple's coming out with their Apple Watch. It just did recently. Fitbit's had one for a while, but it gives you lots of diagnostic information about what's going on in your body, and nutrition and exercise and sleeping patterns and so forth. Very interesting stuff, and I've seen some really positive results with many people that are using these devices. Second is personal genetic services. The first genome was completed in 2001 for $100 million. Now you can get your genome done for $1,000. Now, you may not want to know if you have a cancer gene or some other issue out there, but then again, you may want to know that, and so it's something that's available that now people are seeking. The third one is remote diagnostics. This is where someone's in a different room, a different building, a different continent, remotely doing some diagnosis of you. Best example I can give you is recently a cardiac ultrasound was done by a non-medical person on the International Space Station, monitored by radiologists here on terra firma. That's coming. It's already there right now. Next is smart home health sensors. Now you have video, there's motion sensors, there's automatic timers, there's wearables for those seniors who are at home. But this is all about staying in your home, being independent for as long as possible, not having to go into a nursing home or other kind of facility for as long as possible. This is bringing on huge advances. The fifth one is 3D printed implants. In 2 years, they're going to be able to 3D print a bladder for operation to replace a bad bladder. Mainly because there's only 2 cell types in the bladder versus a liver's got 40 cell types. But this is coming down the line. They already have done an ear, they've done arteries and some other areas of our body for replacement, but this too will happen. Now, we have an event coming up May 16th from 10 to 2. It's our spring cleaning barbecue. It's being co-hosted with Weiss & Company, a CPA firm across the hall. I'll be out in the parking lot here, and we'll have shredding, picking up your old electronics, Goodwill for donations, and a barbecue truck, as well as live music. We'd love to see you here and have a great time with us. So until next time, enjoy.